All right. So good morning, everyone. Again, glad to have you here today now that we have the recording moving. I always love being able to connect with the presenters and I love having the time to spend with these folks. Margaret Berger is very near and dear to my heart. She has been a part of our team for a number of, how many years have you been with us, by the way?
6 or 7.
Seven was the number that I had. It seems like a long time, but it's wonderful. So Margaret is a lovely, lovely human, just a lovely soul. So I very much appreciate you doing this today. And I'm glad that we can share Margaret and all of her knowledge with you. So let me tell you a little bit about her. Margaret Berger is an LCSW, and she was inspired to become a meditator and a yoga instructor by her second born son, Atticus, who was born with developmental disabilities. Living with his challenges and her resultant stress levels, she decided to learn how to quiet her mind and live beyond the stress, celebrating each day with a sense of gratitude and wonder. I love that. Her older son, Abraham, and husband, Michael, have benefited as well from the sense of peace, joy, and acceptance that permeates the family. I can totally imagine that is the case, Margaret. And you're just one of those people who you're lovely to be around, right? You're just a calming presence. And I hear you, it's something that you had to cultivate in yourself, especially when you were in such a crisis or a stressed state. And you've had things, I know, of course, over the course of your life where this has probably come in really handy for you because, we need to be able to stay grounded, obviously, when we can. Her experience as a psychotherapist, training to become a yoga instructor, and her own daily meditation practice have provided a foundation for her to share her knowledge of the ancient practices with others. Meditation is a key to calming the mind so that we can listen to the guide that is within ourselves, leading us down a conscious and thoughtful life path. And Margaret, I know you have gone to India to study. I mean, you have really been a student and a practitioner. So I think you are eminently qualified to share this information today, in addition to just being a lovely human. So Margaret Berger, welcome. Thanks for being here today.
You're so welcome, Margot. Thanks for asking me to do this. Also, that in that description, every time I read that sort of bio thing, I think, when I'm listening to somebody else who's a mental health professional and also a yoga instructor and a meditator and claims, to understand these things, I need to point out that, we're imperfect humans. And it all sounds so ideal. Like if you could just meditate, everything would get better. But, really, it's always just, it just makes life a little bit smoother. It doesn't, perfect your life in any way. I always feel like I have to put this disclaimer out there. And, it just makes you able to roll with punches a little bit more. And so it is a great skill to have in your life and to learn and to cultivate. And it's always being cultivated and you're always relearning it. And you're always being pulled in other directions away from it and, needing to go back to it, needing to delve deeper because life pulls you out of that. Is so fast. All you need to do is turn on the news. So, okay, so on another note, which is the reason why I'm here today, is to discuss how you can use trauma-sensitive yoga, just a little 10-minute practice in your office with your clients or on your screen with your clients. And I'm just teaching this class today because I've been doing this with a group online in a teletherapy modality, a trauma-sensitive yoga group in an ongoing way now since August with a group of people. So if you have any clients or anything that you think might be eligible after you hear how I describe, who this is good for, this is a accessible sort of intervention for then, please do, give me a call or have them give me a call or an email. But anyways, I just wanted to start with a little bit of a practice. And since trauma sensitive yoga is always one of the key elements of it is invitational language. And so I want to invite you all to participate, and you can choose not to. So it's an invitation, and you can say, no, I cannot attend today. And that's perfectly fine. And if you aren't going to participate with me in this little introduction, then you're welcome to just sit in your chair and maybe take some notes or relax or do whatever you want. But anyways, you're welcome to do it with me if you'd like. So let's start by the first form, and you'll be getting the slides and a handout with these photographs of me doing these forms with the proper cues, that I suggest. So the first form we're going to do today is seated mountain form. So if you like, you are welcome to take a comfortable seat, and whatever that may be for you today. So if you'd like, you could take a seat at the edge of your chair, and I'll move my chair back a little bit. So you could take a seat at the edge of your chair, or you could bring your back to the back of the chair for more support. So you have those two choices. You could bring your feet flat on the floor, and you don't have to do what I'm doing. So obviously I pulled myself away from the back of the chair because that was my choice, but you're welcome to sit at the edge of the chair. And then you can place your palms down on top of your lap if you'd like, and you can drop your shoulders away from the ears. And you are welcome to keep your eyes open or closed. And you can begin by noticing any tension in your spine and shoulders. You can maybe experiment with dropping your shoulders away from the ears. Maybe tuck the chin so slightly. Maybe lift the chest or lift the rib cage from the waist. And maybe just take a few deep breaths if that's accessible to you right now. And then maybe as you're breathing, because you'll just breathe automatically, the breath will just move on its own. You maybe could take your awareness to your sitting bones. So maybe just take your awareness to the bottom of your seat, and maybe notice where your body or the backs of your legs and your hips are making contact with the chair. So maybe you can notice that, but there's always a possibility that you can't. And at any time, if you feel uncomfortable or anxious, you're welcome to come out of the form. And maybe just notice your breathing a little bit more now. Maybe noticing where the breath goes on the inhale and where the breath goes on the exhale. Maybe, if you'd like, you could notice the weight of your body on the chair. Maybe just sinking a little bit deeper into the form. And then whenever you're ready, you're welcome to open your eyes if you've had them closed. And come back into the space that we're all sharing together right now. And so you're welcome to join me in the next form. So the next form.
Margaret, sorry to interrupt you. Someone had said it's hard to see you on this thumbnail. I don't know if you're comfortable stopping sharing your screen and starting again, then they can see you a little better. If you're worried you won't be able to get it back, then don't worry about it. But
if I minimize the screen, let's see. No, that doesn't work.
Yeah, I think you have to do the stop share and then we'd have to start sharing.
Okay. Okay, hang on. Stop share. Okay.
There we go.
Okay, so let's finish and we'll move on to the next form. So we're just going to do the 4 forms I'm going to teach today. So you can do something with your clients, and we'll do 4 now. And then if we have time at the end, we can do it again, which would have different meaning because I've sort of explained, why I say certain things the way I do. So, and the next form is going to be a spinal stretch. No, the next form is going to be, now my papers are out of order, just a minute here. Yeah, it's going to be a spinal stretch. So you can get up from your chair here and you can turn your chair and use it as a form of support for your hands. And cushion here. So the form is going to look like, I'm going to show you the picture here. It's going to look like this. So I'm going to help set you up. So you're welcome to join me in this form. You do not have to participate, it's your choice. But to get into a seated to a spinal stretch using the chair, and this is always nice to do in your office. I'm sure most people are familiar with this. It's just keeping your arms about shoulder distance apart, maybe gripping the top of the chair just to secure yourself, and then gently folding into a 90-degree angle so that your ears line up with the inner elbows. And then you can choose, now here's a choice, you can choose to walk your feet back as far as you'd like. And then once maybe you've come into either the full 90-degree stretch, then you're welcome to shoot your sitting bones out in back of you, maybe towards whatever wall or door they're facing. And then bend the knees slightly, if you'd like. And then just look down at the floor, holding your neck in space between, with your ears lined up in those elbows. And then just take a few breaths here. And maybe notice the sensations that you feel in the sides of your body along the rib cage. So you may notice some stretching in the muscles there. You also may notice, let's see, I notice some stretching under my armpits, maybe a little too much, and I'm pulling my shoulders too far out of the sockets, but adjust the form and notice the sensations of the muscles that are stretching, if you'd like. And whenever you're ready, you're welcome to walk your feet back towards the chair and then just stand for a moment and maybe notice the weight of your body standing up on the floor. So maybe bring your awareness to the bottoms of your feet and maybe just feel the sensation of standing and what muscles get engaged when you stand. And then next, we'll move on to our next form, which will be a gentle seated twist. So for this, you're just going to sit at the edge of your chair. You could also sit at the back of your chair and just do a really gentle one. But you'll have many choices of how to move in this form. So you're bringing your seat to the edge of the chair, placing your palms on top of your thighs, and then taking your left palm, placing it on top of your right knee, taking your right palm and placing it back towards your tailbone or your lower spine. So you're sort of like an easel here. So you have a couple of choices here if you'd like. You're welcome to twist while facing forwards. So you can twist a little, get a little torque in your lower rib cage here, and maybe just notice the sensation, until you feel the actual stretch of the lower muscles at the waist and rib cage. So the second choice that you could do is to turn your shoulders and your head at the same time. So you can choose to either face forward and twist, or to face forward and gently move into a deeper twist. So deeper doesn't mean better, it just means what's accessible to you in this moment. And you're also welcome to notice the muscle stretching here. So maybe you notice some sensation in that lower part of your rib cage, or maybe you notice more sensations up in your shoulders or neck. So it's a twist from the lower rib cage. Maybe back off a little bit if you feel too much torquing in the neck and shoulders. But that's your choice. And if at any time you're ready to come out of the form and move to the other side, you're welcome to join me in the other side. So just setting up the same way, but opposite hands. So now I'm taking the right hand on top of the left knee, and the left hand is behind me like an easel supporting me. And I'm just turning and looking over my shoulder. That's my choice today. But you can also choose to just look straight up in front of you and twist from the lower part of the rib cage, just noticing the sensations there. So noticing what you notice in your body in this moment. And then whenever you're ready, you're welcome to move out of the form. So next, we are going to end in our seated mountain form here. So back to seated mountain form is the hub form for trauma sensitive yoga practices. So everybody, if anybody wants to sit out of form, they come to just seated mountain form, where they're taking their seat either to the back of the chair, that's one choice, or to the edge of the chair, sitting out in your seat, 90-degree angle of the spine, tuck the chin, drop the shoulders away from the ears, and just noticing the breath here. So we're ending on this form, the practice, the 10-minute practice that may have been longer than 10 minutes, I'm not sure, or shorter. And so now just noticing your body and how it feels after moving a little bit. So you may feel some sensations, maybe your heart may feel a little bit elevated in its beating. Maybe you feel a little warmer in your body. Maybe you may notice less thoughts floating and flooding your mind, or maybe more thoughts flooding and floating through your mind. Whatever you notice, it's what you notice. And just noticing the chair holding you in space here. And maybe just begin to notice the breath and observe where it goes on the inhalation, if you'd like. And perhaps you can notice where it goes on the exhalation. And whatever other qualities you notice of the breath. And then whenever you're ready, you're welcome to come back into the space. If you've had your eyes closed or haven't, just bringing your awareness back into the space that we're in a class together with many people, many other participants. And thank you for doing that practice with me. I really appreciate it. And I'm going to try and share my screen again now. So today, these are our objectives, and that's to explain the clinical benefits of embodiment and trauma recovery, and how embodiment is really an important part of trauma recovery. If you don't already know that, and I'm sure most of you do know that. And when I talk about trauma, that's a really general umbrella term, but this particular intervention was specifically designed to treat, and it was also designed and evidence-based proven to improve symptoms of complex trauma, of developmental trauma. So complex trauma and developmental trauma are not real diagnoses yet in the DSM. They're proposed diagnoses, and they haven't really, the people at DSM or what's the other diagnostic tool, the ICD. There isn't anything for trauma except PTSD. So the people at the trauma center who designed this modality, they address trauma as either developmental trauma or adult trauma, and they distinguish those two things. And so this intervention was designed, although it benefits people with PTSD, it was only studied to benefit, studied specifically for complex trauma. So trauma that happened in childhood at the hands of a caregiver. So meaning that they were verbally abused, physically abused, sexually abused, emotionally abused as a child growing up. So how many people see people like that? So it's kind of a rarity that we don't see people, that people come into psychotherapy because of sequelae of those abuses from childhood. But, of course, there are definitely lots of people that don't, but I would say a good percentage, and I couldn't specifically say how many, they do come in because they've had developmental trauma. So anyways, that's why this intervention can be so helpful for people that are struggling to heal from complex trauma and developmental trauma. So how does mindfulness and yoga affect our nervous systems? That's also something else we'll cover. How to use this in a psychotherapy session. So the 4 forms I gave you are going to be, photographed, and, the cues are given and everything. So you could use this, or you could just use one form to help a client sort of deregulate from in a hyper aroused state or an under aroused state. So it, helps with hyper arousal, and it helps with under arousal, and it helps you help people regulate the nervous system. So here are the clinical benefits of embodiment. It should be embodiment in trauma recovery. I don't know why it says and, but I screwed that up. These are the results of a study done by many people and many, professional social scientists and neurologists. And I've quoted them in my handout that I sent out So decreased reported symptoms of PTSD, improved cardiovascular health, improved endocrine system, thyroid health, blood sugar management, improved digestive health, reduced inflammation, improvements in rheumatoid arthritis, reduced blood pressure, reduced autonomic sympathetic activation, and it should say autonomic parasympathetic activation, improved vagal tone, increased heart rate variability. So the vagal tone and heart rate variability are terms from George, I always call him George Porges, but it's Stephen Porges.
I'm sure he'd appreciate that.
Just the way my mind works. And but Stephen Porges is the brilliant neonatologist, neurologist. He's got so many degrees I can't even tell you. He studied the newborns, premature newborns, and how their heart rates are very irregular, and how that is, all that dysregulation is, how do you manage that, when the premature baby matures. And so he has studied this in terms of the vagus nerve, and he's become this expert on how the vagus nerve is, well, the biggest nerve in our body, can be regulate our heart rate variability. So yoga does that. Trauma sensitive yoga does that. Stimulates the connection to our frontal lobe. So whenever I give cues, feel these sensations in the present moment, you're also listening to me in the present moment, and you're having to be present and moving in your body. So those are things that create, that makes you, that you have to use your frontal lobe to do that. I mean, and so you're constantly moving clients from maybe who are very stuck in amygdala memory, and they are, also that's where their nervous system is. They're very stuck in a fear-based existence, and they do have heart rate, elevated heart rates, constant elevated heart rates, and doing this yoga can help, bring that down a notch. It can help them be more connected to the present moment, where our heart rate does drop to more normal rates, our blood pressure drops, and we are in our frontal lobe. We're stimulating a connection to our frontal lobe. And people that live in trauma response are not living in their frontal lobe. So they're not connected to their executive functioning as much. They may look like they have ADHD. They may have a lot of symptoms that, they're very impulsive and things like that. So they're making decisions from fear, not from, thoughtful executive functioning process. Also, you may find that if you try this on some individuals, when you talk about the breath, that it is not accessible to people, that they are very confused by trying to control their breath or tune into their breath, or they're very afraid of it. They're very afraid of slowing down, or they can't do it because their nervous system is just not in that modality. So you're just trying to help them get a little taste of those things. So one of the main curative factors of this practice is a term that is, you may have heard of proprioception. And proprioception is just when you learn to move the body in a certain way and your mind remembers. So you learn to do somersaults as a kid, or maybe you learn to do them as an adult. But the first time you did it, you had to sort of take it apart into different components. And then you learned it. And then now you always know what a somersault is and sort of how to curl up in that ball. Now, maybe not as 60-year-old women or men. We're not doing somersaults anymore, but I'm just trying to kindle your memory of those days, maybe when you rolled around on the floor and you watched somebody else do it, and that's how you started doing it. And you remembered how to do it. And now you even know how to do it, even though maybe your body doesn't want to do it. So don't go out there, disclaimer, and do somersaults, but just trying to teach you this concept called proprioception. So then there's a counter concept in neuroscience called interoception. And that is the felt sense of the body. So it's something that our nervous system is constantly designed to surveil. So, whether or not we're thirsty, whether or not we're hungry, whether or not we're sleepy, these are all interoceptive awareness processes that our nervous system is always sending us feedback, in certain ways. And we have to be, it's sort of like a muscle or a skill set. So if people have suffered from extreme complex trauma or even mild complex trauma, there have been times where they've turned off their bodily needs just to survive. So, they may not have had food at regular times because they were neglected. And so they've had to turn off their hunger, or they, all even emotional, sense to be close to other people. They've had to turn that off. Many things like a growling stomach or tense muscles or racing heart, they've learned to tune out because those needs weren't met and they had to survive or suppress. And so their interoception, their ability to feel their bodies, is very weakened. It's just not a strong thing. So we want to strengthen those things because they lead to other sort of processes that we can be better at, like judging whether or not, a job is too hard for us, or judging whether or not, we want to go out 5 nights a week in a row, or, things like that. Just self-care generally can get stronger if we have stronger interoception. So during the practice, I cued you to maybe notice your muscles stretching. I also cued you to feel your legs as you stood up, or to feel them on the back of the cushion. And you can also just say you may feel something else when you're teaching this to a client, and you're twisting, you say, or you may just feel something different than what I'm even suggesting. If you're noticing what you feel, noticing what sensations, notice what you notice. I'll say things like that. So you're just trying to facilitate them tuning into sensation because you're strengthening their interoception. And also, here, I'm going to go back here. So the 5 core elements, I'm just going to interrupt this little slide here and see if where are 5 core elements. Okay, on this slide here, the 5 core elements of TCTSY, trauma-centered, trauma-sensitive yoga, are what? Invitational language. So you're always inviting your clients to participate and giving them the choice to not participate. You are offering them choices of how to move, reminding them they always have choices. And this has far-reaching consequences for people when you keep reminding them of choices. It's like PT, physical therapy for their brain. And so they go out into the world when they've been reminded, and I'm sure you say in session a lot, you have choices. You don't have to do this, you don't have to do that. But to have them make a choice in their body in the present moment is another way to strengthen that and encourage that. interoception. So I wanted to explain that to you before I just threw the word in. So now you have an idea. It's the felt sense of the body in the present moment. It's our surveillance system that our nervous system is always, like sending out signals to check on these, what's my body temperature? Or am I hungry? Is my mouth dry? Blah, blah, blah. That's interoception. Then the fourth element is shared authentic experience. And the reason why I want to drop down to this is because when you're doing the forms, you are doing the forms with the client. You don't just sit there and order them to do the forms. You have to do it with them because you have to have a shared authentic experience. And that also has sequelae for the nervous system, especially the vagus nerve, because when you do something with somebody else and you share an experience with them, which psychotherapy is like that, but this is just a much more refined version of creating this shared authentic experience. So you're feeling in your body at the same time that they're feeling in their body. They're not just telling you about something that happened in the past, in their life that was painful. You're having a current experience, and it also offers opportunities for fun and play and laughter. And, these are all very stimulating to the vagus nerve. And you may notice that many people that are in trauma recovery may have very flat emotional affect. But, they can be at the other end of the spectrum as well, but, and very, heightened, affect, but they can also have very, dull affect. And so, stimulating the vagus nerve can help them have more of a social interactive experience that strengthens their vagal tone and increases the strength for them to go out and make friends or to interact with others in a healthy way. And then the fifth element is non-coercion. So we never want to, dictate, like in many yoga classes, in many yoga studios, it's the teacher is the master and the students just do whatever the teacher says. And we don't want to create that environment because many people are coming from coercive childhood experiences where they didn't have choices and they were bossed around and what they said and thought didn't matter. So, to keep in mind that we want to have that kind of languaging at all times. So that's why we use invitational language, because that's very non-coercive. That's why we offer choices. So, all that languaging has, very deliberate sort of effects on people's minds, because you're repeating to them to gauge in their own bodies, in their own nervous systems, what they need in the present moment. So that's very, very powerful. Okay, let's see where we are here. So how to use in a session. So one research study that when I was studying at the trauma center, that one of the slides that they presented to me in the training that I did, a 300-hour training there in 2015. And one of the, there was a research study done by somebody named Fukushima in 2011. And he found that he did a study that he measured people doing an interoceptive task, and then he tested them on an empathy scale. And the people that did interoceptive tasks scored higher on an empathy scale. So, I mean, that's just fascinating to me because if you've got people that aren't even, in a place where they can care for themselves properly, if they start to tune into their bodies and, just feeling sensations in the present moment, that they may treat their bodies better. They may have more self-empathy. So I just think that's very fascinating. And then a professor of neuroscience and psychology at USC and philosophy, his name's Antonio Damasio. He wrote a book called The Strange Order of Things, and many other books that are on neuroscience. They're very well, is that the word? They're very geeky neuroscience books. So, I mean, you may like to read it, or, if you're interested in those things. I just look through those books and take out things that, from the index. I don't read them cover to cover, but there's so many fascinating things that neuroscientists are finding. And so Damasio is really responsible for talking about interoception. It's very, very front seat neuroscience in terms of, that being a very important process of our brain, that our nervous system is always snooping and reporting back to let the brain know what's going on in the body so that the brain can intervene. So if we're strengthening that part of our brain by doing movement with interoceptive cues, then we'll be able to be more tuned into our physical needs and all the cues that come in our body. Yoga movement can create an opportunity for safe mobilization, but also safe immobilization. In other words, when we start to move, and any movement, I would say, may be done mindfully. It doesn't have to be yoga. It could be Tai Chi, it could be Zumba, or whatever. At least we're moving our bodies, and we're not immobilized by fear in those moments. Also, we're down regulating in a safe way. So a lot of people with trauma have learned to turn down their nervous system so low that they don't move, that their heart rate lowers to maybe even a point of unsafe levels. And then they kind of get stuck in that very low vagal response. It's like dorsal vagal, I think. And what we want to do is be able to rest and be embodied and calm, learn how to relax. So that is something that yoga is going to help with too. So how to use this in a session? Okay, this is the important stuff. So first, is the client a survivor of interrelational trauma from childhood? So if yes, then you can move forward with the rest of the screen. You can do this with people that don't have childhood trauma. I mean, there's no question, but I'm just, this is how I screen, and because I'm doing group for people with complex trauma. But, since this is a proven intervention for that, perhaps you'll just want to use this on those clients. So ask yourself how many of your clients may be victims of interrelational trauma from childhood. Okay, and maybe just have a sense of how the client is connected to their body. In other words, do they seem very down-regulated or hyper up-regulated, or hyperactive? How connected are they to their body? And, are they interested in learning about this? And would they like to do it for 10 minutes here or there? Just to, learn how to use it in their life. Where are they in terms of their mental health treatment? How long have they been in therapy? Is this their first time in therapy? Maybe you are the first therapist they've seen, or maybe not. But if you are, then maybe wait a year before you try this, unless you really feel like, they're the type of person that's very connected to their body. So if they say they like to exercise, they find that very, very helpful, then then they've already made that connection that movement is helpful for them. It regulates them. If somebody's suicidal, I wouldn't do this intervention. It's counterindicated. So until they're far away from any suicidal ideology and suicidal acts, or if they've been hospitalized. So I would also wait about 6 months post-hospitalization. So, and also if you do try this and you think, everything's right, for the trying, I made so many mistakes trying it too soon with different people that were trauma victims. And it can make people very, very, it can stimulate a lot of emotion, and it's so foreign, they get very flooded. So flooded with emotions. I had one client who we would just do a twist and I would say all the things that I was saying to you guys, and tears would just flow from her eyes. And she didn't even know what those emotions were from. Like, she could not connect the two. And I talked to this is when I was training to do this intervention. And I talked to my supervisor about it at the trauma center. And he said, "Oh, you're giving her too high a dose of interoception." I was like, what? So interoception's like a drug that you can titrate up or titrate down. He said, maybe don't talk about sensations so much, titrate that down a little bit, maybe just, go through the forms and don't ask her to feel her body. And, and then work up from there, just give her little teeny cues. And I was like, wow, how, that is just unbelievable. And it was true. It really was true. Once I stopped talking so much about feeling sensations, because, I can say it a lot, feel this sensation, feel that sensation. This is where the art of this practice comes in, and knowing, when it's okay to start adding more sensation cues and things like that. So it's very powerful for people that are very shut down from their mind-body connection. So the next form we'll do is sun breathing. So if you look at the slide, all we're going to be doing is lifting our arms either up and down or lifting them up and making a circle, right? That's all sun breathing is. So you could choose to just go up or down with your client. What you're not doing, you're giving your client the choice of going up or down or up and around. And so you may choose as the clinician or the person doing the yoga and having a shared authentic experience, you may choose to just go up and down, because let's say you as a person are having problems with your shoulders and you can only go this high. And then maybe you give the option, for the client to go around, but you don't have to demonstrate. You can show them a picture that I've given you here, and they can make big arms and make a big circle. So you're welcome to join me in sun breathing if you'd like. I'm setting up the form. While sitting in a seated mountain form, you can sweep your arms up in a big circle, or choice making, you could choose to lift your arms up and down. So you may even want to say it a couple times. You could choose to raise your arms in a circle or lift your arms up and down. Then the two of you go off and do whatever you guys choose to do on your own. And you're doing whatever you've chosen together. There's no right or wrong way to do it. Then you may suggest to them, as you're moving, you may notice the muscles stretching on the sides of your body as you raise your arms up. So either way, if you go up and down like this, or you do this, you are moving these muscles here. So you're not going to, screw up if you're moving your arms one way or the other. You're still moving the muscles on the sides of your body. So you're having an interoceptive experience, and then you're doing it with them. So you are also having a shared authentic experience. Then you're also having a non-coercive experience because you've given them a choice. You've invited them to do it. And that's non-coercion, shared authentic experience. So you're welcome to join me in the next form. So you always invite them to the next form as well. So the next form being the spinal stretch. You're welcome to try a spinal stretch with me if you'd like. So you're welcome to place your hands on the back of the stable chair and then walk your feet backwards. And you could choose, okay, here are your choices. You could choose to walk back just a little bit, or you could choose to come in a full 90-degree. And those are your two choices here, if you'd like. And then you're welcome to align your ears up with your inner arms. Maybe separate your feet about hip distance apart. And then shoot your sitting bones back towards the back wall. And maybe push them away and push into the chair slightly to lengthen the spine, or a sensation of lengthening might be felt. You also may notice the muscles on the sides of your rib cage, maybe in your lower back. And then whenever you're ready, you can walk your feet back. Just pause here in a standing form, noticing the weight of your body in a standing form. This is standing mountain form, by the way. This is another form, but I don't want to add too many forms for you guys and confuse you. So you're welcome to join me back in chair. And then we will do the gentle spinal twist again. So here's a picture of me doing the gentle spinal twist. First thing you always do is you set up the form, and you can use more coercive language when you're setting up the form. In other words, you don't have to say, please take your right arm and please place your left, hand here. You can just set up the form. Take your right arm, place it here, take your left arm, place it here. So you're going to take your left arm, your left hand and arm onto your right knee, and your right arm as an easel, and put it in back of you. And then you're going to twist. And here are your choices. If you'd like, you're welcome to twist with your shoulders and your waist. So that would be one way of doing it. Or you could keep your shoulders facing the front of the room and then just twist from the lower waist. So those are your choices. And then here's an example of another shared authentic experience. So maybe today, you're noticing you're stiff because you had a tough workout at the gym yesterday or something. And you're welcome to comment on how you feel your body, and just go, oh, that's a little bit hard for me today. I mean, you're trying to be in your body in an authentic way as a way of teaching them to be in their bodies in the present moment in an authentic way. And it's even deeper than that. Just being a human with the other person is so deeply connective and healing. I mean, it's a simple thing, but you're doing something together and you're sharing how you feel. All right. You're not divulging your deepest, darkest secrets. You're just saying, I feel this in my body right now. And that's a very genuine thing to share with somebody. So then we're going to end in a final seated mountain form, just like we started. So this is just mindfulness, basically you're just setting somebody up to sit and notice their breath if they can. And if you know that they can't notice their breath, so maybe you don't talk about the breath. You just talk about feeling the weight of the body on the chair, feeling their sitting bones, feeling what you feel in your body when you're trying to line up, is a very authentic experience. So you're welcome to make those choices in terms of what to share. Marco, without being, I don't know if you have any clients that have done this technique with me. I don't know if you'd feel comfortable with any anecdotal material without, divulging anything.
Oh, yeah, definitely. I've had actually a few people who have done this work with you. And I'll tell you, it's just part of the joy of working as a team is that, we have these resources available and then we can say, oh, I know what's happening over here. This would be a really good place for you to go. So I'm thinking of one person in particular. This is a woman who's in her early 60s who may have ADHD throughout the course of her life, but also a lot of developmental trauma. And so that always is kind of the tricky rule out. People want to know, is it this or is it that? We don't always know. I can't climb into their brain, even if we have a scan and say, well, this is actually ADHD. Perhaps someone with more assessment, neuropsych skills than I have could do that. But what I have found is that, we were doing some EMDR and some other interventions and some somatic experiencing pieces. And I think those were helpful because what we were trying to do is help her have more vagal tone, tone with her vagus nerve and being able to get out of that sympathetic fight or flight response and back into a more parasympathetic state. But it was hard for her to hold. Like she could get there and then she'd pop out and she'd get there and she'd pop out. But once she started doing this work with you, Margaret, it seemed like the practice that she was doing allowed her to have more sustained time in those regulated states. So she looks and feels far less ADHD most days. And if we're in session and she doesn't look less ADHD, we can talk about, well, what would Margaret tell you to do? What would Margaret suggest? Let's do it together. And then we'll do it together. And to your point, right, it's that shared experience. I don't sit there, especially on a screen and gawk, thought I'd be gawking, but it's just very different. And I benefit from it. And I will share some of my experience, what it was like to do it. And she'll share hers. And then she's more regulated and ready to go and can benefit much more from the session. So even with other trauma-informed interventions or trauma-specific interventions, I think her system really needed this practice as well. So I'm a huge fan. I think it's really, really beneficial.
That's so awesome. Yay. Yeah. Well, there is so much research going on with this. The Center for Trauma and Embodiment continues to do evidence-based research. Social scientists are doing it all the time, and they're publishing new studies. And a big study came out last year that was done in 2019, the results of it, but it was over like a 5 or 10 year period that they did this study at the Veterans Administration, comparing the trauma sensitive yoga intervention. This is with veterans. So although many of them have complex trauma and also PTSD trauma from being in the military, and also this was a cohort of women, mostly women that they studied that had been sexually assaulted in the military. And they studied this group, comparing the intervention that the VA uses, which is, this is their tried and true, reliable form of intervention for trauma, which is they make people write about their trauma. it's I forget the name of it, it has a name, and that's what you do. You go and you journal about what happened to you. And so therefore, by putting it to words, it helps you get over it, and this is the theory. And this is all they use. I mean, this is their main standard of treatment for PTSD. And this is true. I kid you not. And so they compared this to, and that is a 12-week intervention course of that intervention. They compared it to a 10-week intervention of trauma-centered, trauma-sensitive yoga. And what they found was that after 5 sessions, because they were giving people questionnaires all along, they were looking for a reduction in PTSD symptoms. They found that on all of PTSD symptoms, there was a reduction in symptoms doing TCTSY, doing this trauma-informed, trauma-sensitive yoga intervention, versus like no reduction in symptoms after 5 sessions of even the intervention of writing down your traumatic experience. So, hopefully, and this is their hope, that the Center for Trauma and Embodiment is hoping that, they can really get, they are using more trauma-sensitive yoga at the VA, but, it's hard to find trained people to facilitate it. It's easy enough to teach anybody to do it, but it just hasn't, they haven't devoted time and energy to training people on the intervention. And so we're hoping to, get that moved into the VA in a much more, formulated and a consistent kind of a, intervention. And that is, really, really what the goal, of the research is, to just validate it, to keep, introducing it to different forms of therapy and group therapy, and for PTSD, for non-PTSD.
Yeah, Margaret, I think, that's, there is so much to be said for that. And it makes intuitive sense to me that would be the case. And of course, watching clients I've been working with also work with you, it makes sense. But the more I understand about the nervous system, the more that just makes good intuitive sense. So we have a few things in the Q&A. Are you ready for that?
Yeah.
Okay. So Shiraz, again, thank you. I have found this helpful with clients struggling with physical pain too. I would love for us to do a workshop on working with folks with chronic pain during COVID. I don't know about you, but I've noticed my clients I work with who have chronic pain, everything is just so exacerbated. I think we really need extra to help people with chronic pain. Would you recommend doing, this is also from Shiraz, would you recommend doing some things specifically for folks having trouble with physical pain?
Yes and no. I think it's a judgment thing, and that I don't know what your training is, Shiraz, but that maybe if you speak to their physical therapist, or you speak, get a doctor's thing. I always think that checking those things are helpful. It's certainly not, sometimes trauma victims feel chronic pain, that's like the way they feel their trauma. So they're holding something. So just do really thorough screening, and maybe talk to whoever they see for their chronic pain, and know what medications they're taking before you move forward. And if you have a supervisor or somebody, discuss that with them too.
Good idea, or consultant. Yeah. And we'll see, Shiraz, if we can get somebody to come and speak with us about treating physical pain, with these more body-based neurologically based interventions. I mean, I know they're body based, but they're really neurologically based and
Yeah.
nervous system based. So
One more thing is that, yes, Shiraz, I do have people in the group with chronic pain, like really, chronic, severe pain that's just been ongoing. And it's just not an issue. They're able to do this practice. So, this is so gentle. If you want to learn more of the forms, they're in Dave Emerson's book. He has pictures of all the forms and a practice that's, got like 10 or 15 different forms that you could choose from. They're so gentle and mild that, you're not definitely, you can see which ones will work for the client and which ones won't. You just always have to be flexible.
So, Margaret, thank you so much. As always, lovely to see you, lovely to spend time with you. I too like your style, love your spirit.
Thanks.
Thank you. Wonderful and delightful. So if someone wants to connect with you and ask more questions, how would they do that? And then Chris, if you can come back on and finish up the housekeeping for the folks who weren't here for the beginning, that would be great, please.
Just Margaret Berger at the junipercenter.com. And they can go to the Juniper Center website and look me up there too.
Okay, wonderful. Well, Margaret, thank you so much. All of you, thank you so much for joining us today. We hope you'll be with us next time. Have a wonderful, wonderful weekend. Be well, everyone. Thanks, Chris, for all of your assistance too. And
Yes,
from Mark
thanks,
Maluga.
Chris.
Thank you. Bye.